Local programming on KRWG Public Media made possible in part by viewers like you. Thank you.
This is KRWG Public Media, TV, radio, online, news that matters. Now, across the Mesilla Valley and the borderland, the stories that shape our community. From the KRWG Broadcast Center at New Mexico State University, this is Newsmakers.
Thank you for joining us for Newsmakers. I'm Casey Counts, and Happy New Year. We're starting 2023 with high hopes for health after ending 2022 with a tripledemic. COVID-19, RSV, and the flu ever present during the holidays. And as we welcome the new year, we want you to be armed with the best information from local experts. We're pleased to be joined by Dr. Dolores Gomez, Chief Medical Officer from Memorial Medical Center in Las Cruces, and Dr. Edward Michelson of Texas Tech Physicians of El Paso. And we begin with Dr. Gomez. Welcome back to KRWG and Happy New Year.
Thank you, Casey. Thank you, for, as always, for inviting me here.
Well, it's great to have you back. And, you know, I just want to know if your staff has gotten any kind of respite from just going from one thing to the next over the last few months.
It's come in small spurts. I wish I could say that we've had a much longer period of respite. It feels like, you know, as COVID was getting better, you know, then things started to kind of increase from there. So by and large, though, everybody's doing well. But yes, they are still fatigued and would like a longer break of rest for sure.
Yeah. Well, let's start with COVID-19 and what we're seeing in southern New Mexico and around the state, and how it looks different from the way it did the last time you visited with us.
So I think the last time I was here, we were dealing still with Omicron. We still have Omicron, but with a little bit difference in variants. And as expected, we assumed that we were going to continue to see variations of Omicron. Right now, we are dealing with BQ1 and BQ1.1. The good news, similar to our previous variants, is that it tends to not make people as sick. Thank goodness we're not seeing as much of the rates of ICU admissions and kind of the high death rate that we were before. However, we are still seeing admissions coming in. Usually they tend to be a little bit lower acuity, but with requirements of oxygen. Our healthier patient population obviously is able to get through with kind of just a bad cold, bad flu-like symptoms. But the contagiousness is the biggest concern, which is continuing to affect our workforce. And of course, the hospital isn't immune to that right now either. And
what treatments have we settled on at this point?
So at this point, with the current variants, what we're seeing that's working best is our oral medications for our outpatient treatment. Paxlovid still remains kind of the mainstay for treatment. There is another oral medication, molnupiravir, as well, that can be used. We've had seen, of course, a waning, though, in some of the IV infusions that we were using more commonly in the past. Those are all the bebtelovimabs and those medications. So right now, our oral medicines are our best option for outpatient treatment. And in the inpatient setting, we're still using kind of the same things, steroids and a couple of other antiviral medications.
Now, it may have taken me a long time, but anything with MAB on the end of it is monoclonal antibody?
Correct. All of those monoclonal antibodies now do not seem to be as effective to our current variants, but doesn't mean we're kind of keeping them in the arsenal that with other variants that they may still be responsive to them as well.
All right, well, let's move on to RSV, because obviously keeping the kids home for so long helped us, you know, say a virtual goodbye to certain, you know, seasonal diseases. And then no doubt, no surprise to you that they would come back with a vengeance. And so what have you been seeing over the last few weeks in terms of RSV?
Well, so RSV is the big talk right now throughout the state. And I will say that in pockets in the Southwest, we have seen much higher rates than we have in other parts of the country. In New Mexico has not been immune to that, unfortunately. Of course, it's hitting our littlest ones. The ones that tend to get the sickest and end up in the hospital are those less than 2 years of age. But we are seeing older kids with it as well, especially those with other health-related illnesses, especially asthma or reactive airways. A lot of oxygen requirement and sometimes long hospital stays to get them off of that oxygen. It has caused a little bit of shortages in some of the medications that we can use more as symptomatic use for treatment, but definitely our state is seeing a pretty big surge in that.
How does this disease compare in terms of mortality for children to COVID-19?
Always, and the good news always has been that in our youngest population, we haven't seen very high death rates with it, both with RSV and with COVID. But with RSV, because it is a pretty significant respiratory illness and it does affect our youngest of kids, there is always an increased risk for them. But thank goodness with kind of the treatments and getting them in the hospital, we're able to get them better, but it can be a little bit of a long haul to get them there.
And let's move on to the flu now. And flu is a concern and kills such a wide range of numbers of people every year. I don't know the average, between 25 and 35,000 people a year maybe?
Yeah, absolutely. We use that a lot as in comparison when we were at our surge for COVID and what the big difference was. You know, people wanted to compare it to flu, but flu death rates are still fairly high. Wasn't as bad as when we first hit with COVID, but it definitely is a significant amount of death rate with it. And of course it hits our most vulnerable populations, our youngest and our oldest. And we are definitely at a different stage than we've ever been in New Mexico. Normally we don't see flu really peaking or bothering us until kind of the later part of winter and then kind of going into the spring. End of 2022, though, we saw our rates go significantly higher. We're normally at about a 3 to 4% rate of flu around December and January. For us, though, this year we were closer in the state at about 14%, and in Doña Ana County we were even higher than that, between 18 and 20% for flu rate.
And how deadly is this flu virus showing itself to be?
Well, definitely in the populations that are getting hospitalized with it, again, our older populations who are going to be more immune compromised, the rates of death are going to be much higher for them. The good news, though, is our current flu vaccine that we do have has actually a really good percentage of actually being able to prevent the flu. So we continue to encourage at any time during the flu season to go and get your flu shot to help lower that risk to you.
Well, that's exactly where I wanted to move on next, was the topic of vaccines. And so we have this bivalent booster for COVID-19, which as far as you can tell, how are New Mexicans doing at taking that shot?
New Mexico is doing a little bit better, I will say, than kind of nationwide, but we definitely always have room for improvement. Just recently, I'm sure you're aware that the CDC went ahead and are starting to offer the booster to our younger population, as young as 6 months of age now. So that's a great thing to help kind of keep the rates of COVID down. It still is effective. Now, when we first came out with the vaccines, we were super excited to know that we had a vaccine that was close to 90% effective. We're not that close, but that is still okay. Having some percentage above 50% for a vaccine is still a good thing. So I don't want people to be discouraged knowing that the chance that you won't get COVID with the vaccine, that isn't a possibility, but you can still be protected, and even if you do get sick, more than likely you'll be less sick by having the booster on board.
It did seem a little disheartening that after 2 shots and a booster, just within a few months later, you had virtually no protection against contracting the virus. And so do you think that somehow kind of kept people from going back for more?
I think so. I think, you know, the initial kind of response that we did have to the vaccine, I think everybody was just so relieved to have that. I think we got a little bit of vaccine fatigue, though, as things went, and I think that has affected our current flu vaccination rates as well. But again, most things aren't 100% in medicine, but knowing that you can have at least some prevention of about 60 to 70% is still much better than actually getting the infection, ending up in the hospital, or getting others sick as well.
Let's move on to testing. How accurate are our current tests now? We're seeing PCR testing diminish in accessibility now. So how confident are you that we're seeing accurate test results?
Yeah, unfortunately, without the PCR test, which still remains kind of our best test to know if you have COVID or not, the self-tests have not been as reliable. We started to see that as Omicron came on board, but definitely with the current variants, you can't always be so secure when that self-test at home is negative. We do continue to recommend retesting within 48 hours to see, and if you know you've been exposed and you have symptoms very similar, you should just assume that you probably have COVID, even if your test is negative.
Does this make it very hard, if not impossible, to, I mean, it's a phrase we got used to hearing a lot in the beginning stages of the pandemic, is following the data. But it seems like we're just not going to get good data at this point. Does that concern you?
It does. I think we have a little bit false sense of security as you say, well, gosh, I have a test that's negative. Really, our best way to know rates is going to probably be more based on hospitalizations. But the tough part with that too is because we know it is a little more mild, not everybody gets hospitalized. So we have to continue to be as vigilant as we can in really paying attention to how we feel, staying home when we feel sick, whether it's flu, COVID, RSV. We need to be vigilant in making sure that we're caring for ourselves and for our community as a whole.
Let's talk about what happens when hospitals fill up and the process that hospitals have to go through to manage care.
So we are back again, very close to what happened when we had COVID at our peak in the state, where we're back to what we call a hub and spoke model. Both the northern part of the state and the southern part of the state are trying to build hubs around those larger hospitals, maybe with more capacity, to help those outlying spoke communities to be able to get patients to and from those locations. In the northern part of the state, if they're having a much higher surge, they need to be able to reach out to the southern part of the state, to some of our larger facilities, to try to help get patients the care that they need, even if they may be traveling several hundred miles away from their home.
It's all very complicated in terms of these plans and the logistics that go into it, and the people that you no doubt have to work with and communicate with on a regular basis. What would you like to say about the efforts that are ongoing in the state?
I think our state has actually done a wonderful job in being sure that our patients in the state of New Mexico are being cared for as best they can. The development of these programs, the hospitals working together, getting leaders within each hospital and even within the Department of Health and with Secretary Grace to really say, how do we continue to serve our community, and especially in a community that we already know is underserved. New Mexico has always been an underserved, medically underserved state in general, and for us to be able to come together to try to ensure that we can continue to provide care to our patients. I think the state has done an excellent job in doing that.
Now, I do want to note one additional, getting away from the tripledemic, maybe a quadrupledemic, hopefully not. But heart health during the holiday season and during the colder months in general tends to be an issue for a lot of people. So what would you like to say about people and heart care during the holidays and beyond?
I think in general we always have to think about that, about really trying to stay healthy as much as we can. Obviously, holidays is a great time to overindulge, and that isn't just in food. It also includes imbibing in our spirits that we do. So we need to kind of remember to maintain moderation as much as possible. Stay healthy by getting out and walking. If you exercise more than that, get out and exercise. There's a lot of great gyms that you can still remain indoors as much as possible, but we have to kind of maintain that same healthy lifestyle as we can through the holidays to help protect us from infections as well, such as what we've been talking about.
And what advice do you have, other than that, to help our viewers get off to a happy, healthy new year?
I would say if we don't want to talk about it in terms of very specific viruses, because I know that a lot of people, get a little bit of fatigue from that, but we need to kind of remain vigilant in doing the things that we know help keep us healthy. Continue to wash our hands. Definitely, if you're going to be in indoor closed locations, if you're sick, stay away. If you can, stay home if you're not feeling well. It's an important thing to do so we don't continue to spread any infections. I am still a very big proponent of masking if we're going to be in places in close quarters, because that does definitely reduce infection rates, not just for COVID. That includes flu and other respiratory illnesses as well. So we just need to kind of stay smart in what we already know does work to keep us well.
And do you have any predictions for 2023 in terms of what we're going to be facing?
I think that we'll still be dealing with this through the winter and probably early spring months with definitely flu for sure, and probably other respiratory illnesses for our kids. The good news is we're continuing to see things improve from a COVID standpoint. We think COVID will be very close to what the flu is, where we may need annual vaccines for that. But we just need to keep doing what we know is important to our community, and that is to stay healthy and do everything we can to protect those that are more vulnerable.
All right. Well, Dr. Dolores Gomez, Chief Medical Officer for Memorial Medical Center, thank you so much for spending this time during this first week of January with us.
Always a pleasure, Casey.
So glad to see you. And now we'll turn to Dr. Edward Michelson from Texas Tech Physicians of El Paso. Dr. Michelson, welcome back to KRWG Public Media and Happy New Year.
Happy New Year. Good to be with you again.
I want to talk a little bit about what you were witnessing in El Paso as we moved through the fall and got into the colder weather, especially as it pertains to RSV and the hospitalization of children there.
Yeah, so like the rest of the country, we've seen a dramatic increase in RSV, really as well as influenza and COVID as the weather has gotten colder. And definitely starting in November and all through December, there's been a dramatic increase in cases of all three.
When it comes to children, which one of those concerns you the most?
You know, RSV, I mean, we are used to seeing RSV. We're used to seeing it in the winter picking up, maybe a little bit earlier this year. However, we had much less RSV and influenza during the first year of COVID, primarily because schools were closed and people were wearing masks. Now that we're out and about and there's not much mask use, there's been an explosion of RSV among children.
This probably isn't a surprise to someone like you that this was going to happen. So what do you do to prepare for this kind of a surge in viruses that we haven't seen for a while?
Well, one of the things we try to do is keep our own staff safe, healthy, and on the job. So we have encouraged everyone to make sure that they're up to date with their influenza vaccination, as well as with their COVID boosters, because that right now is our best protection against getting sick from those two viruses. Unfortunately, as you know, we don't have a vaccination yet for RSV, and maybe some point in the future we will.
So what was the situation like for El Paso Children's Hospital through the course of this increase in viruses all around?
This has really stressed all children's hospitals, and El Paso Children's was not left out. We're seeing tremendous demand, not only on ERs for ER visits with kids with sniffles and coughs and cold-like symptoms, but really the intensive care units and the inpatient beds across the nation have been just full of patients.
Can we talk about what makes, and do we know what makes one virus more dangerous for children than another, say RSV versus COVID?
Yeah, so, you know, over time, with exposure to viruses, those of us with intact immune systems tend to develop antibodies. Even for those viral infections where we don't have a vaccine, your body will mount an antibody response. And one of the interesting things, and maybe a side effect, if you will, of the COVID pandemic was we had a couple of years where very few people got infected with influenza or with RSV. So over time, those antibody levels have actually dropped. In the case of children, there are probably some very young children who never really saw the RSV virus and never had the opportunity to develop antibodies because of the fact that COVID kept us away from each other and out of school. So I think that's made for the big comeback in RSV. And we'll have to see going forward whether future seasons will get back to normal or whether this will be our new normal.
I'd like to get your thoughts a little bit on what you think is in the near future for vaccines. Each year when the flu virus comes out, well, I should say when the vaccine comes out, we don't necessarily know if it's going to be the exact right vaccine for the flu virus that will become the dominant strain. How are we doing this year?
So it appears that this year's vaccine really hit the mark. The early predictors or the early determinants are that we actually have a very effective vaccine, better than some prior years. But that's also at a time when people haven't seen influenza, so our native levels of antibody might have been reduced. Also going forward, I'm kind of encouraged by everything we've learned about making vaccines, and specifically the mRNA vaccines that were developed in record time for COVID. This same technology can be applied to influenza and to other viruses. And I predict in the coming year or so, we're going to start seeing mRNA vaccines that are targeted against influenza. The beauty of that is if you can develop and manufacture a vaccine much more quickly, you have a little more time to wait to make sure that you're developing the right vaccine against the right strains. So hopefully in future years, we'll have an even better vaccination to give to people.
And do you think that that will be that much more close to a vaccine for RSV as well?
Well, that's a great question, and I'm not sure where we're at in terms of developing the vaccine for RSV. RSV is fairly common in adults as well. We usually don't test for it, and most adult patients with RSV are going to simply have cold symptoms. It's really a big problem, though, for the very young children, as well as the immunocompromised. So I do know that work is going on to develop a vaccine for RSV, but I'm not quite sure how soon we're actually going to see one in production.
I'd like to talk a little bit, circle back to COVID in the El Paso community and see what, your thoughts are as we move into the new year. What are we going to be seeing as far as new variants of COVID-19? Is there going to be something that we're not going to be referring to as an Omicron variant?
That's a great question. The virus continues to mutate, continues to evolve, and those versions of the virus that spread more readily seem to take over. So going into the fall, BA5, the BA5 variant of Omicron, was predominant, but it's now really been replaced by newer ones called BQ1 and BQ11, and I'm sure we're not done. There will be new letter combinations of new versions of the virus going forward. My hope is over time that we'll have a virus that causes less severe illness, even if it spreads rapidly or easily. As long as it doesn't cause more illness than a severe cold, we'll have to just learn to live with it like we do with influenza. And I'm hoping over time that the number of people in the hospital, the number of deaths associated with the new variants will go down. But I don't think it's going to go away totally anytime soon.
Let's talk a little bit about how deadly these new variants have been, especially for the El Paso community.
Sure. Well, as we've gone through the month of December, we've seen a steadily increasing in numbers of patients who are coming to the hospital. Here in the emergency room at UMC, day to day, we're seeing many more people coming in with symptoms, but most of them actually are going home. They're not needing to stay in the hospital, thank goodness. That was a much different scenario 2 years ago. At the end of 2020, we were overrun with patients who were so sick that they needed supplemental oxygen. Many of them were on ventilators. The ICUs were overflowing. As I look at our numbers through December, of only about a third of patients who were diagnosed with COVID were really in the hospital because of it. When any patient is admitted to the hospital, we usually test them to see if they have COVID. And more than half were coming in for a different reason. That's not to say that COVID didn't play a factor in them being ill, but it wasn't the main reason they were in the hospital. So that makes this year substantially different than last year or the year before.
And let's get an update in the last few minutes here that we have with you, Dr. Michelson, on some of the important research work that you're doing there at Texas Tech University Health Sciences Center.
Yeah, thanks for remembering that. We have several active trials related to COVID-19 that are ongoing. First, we're still part of the National Active 6 study. This is enrolling patients with medications that are already approved by the FDA, but for different diseases. And we're continuing to work through that list. So if someone does have a positive COVID test, I would urge you to get online, go to active6, ACTIV number 6.org, and see if you qualify, and please sign up to participate. Texas Tech and UMC are one of about 90 sites around the country that are enrolling patients. Here locally, we also have several other studies for COVID-19. We're studying a medication called cromolyn sodium in a manner similar to Active 6, and we have an inpatient arm as well as an outpatient arm involving a nasal spray, cromolyn. And we're doing some very interesting work on COVID brain fog. We are taking patients who have COVID now and have neurologic symptoms and obtaining EEGs, quantitative EEGs, to see if we can identify an electrical marker of brain abnormality in patients who have COVID brain fog.
Now, those are patients with active COVID. What are you seeing in patients who have long COVID at this point? What signs of hope are there?
Well, there's a lot of work to be done. The federal government is spending billions of dollars studying how to best treat patients with so-called long COVID. And long COVID can affect multiple different organ systems, not only the brain, but some patients have chronic lung issues, shortness of breath, fatigue. There's a whole host of things we believe might be related to patients who don't fully get over from COVID. So I think the coming months will show us hopefully new exciting treatments and options for treating those patients.
Well, let me ask you for the final question today, Dr. Michelson, what advice you have here in the first week of January for folks in our area to have a happy, healthy new year?
We want everyone to have a happy, healthy new year, to start out 2023 on the right foot. I know it hasn't been popular to talk about masks or to suggest people wear masks or avoid crowds, but so long as we're in the cold months and we have a few of those left, I do think it's important, if you have any symptoms, to stay away from other people, particularly the elderly or those who are potentially at high risk for complications from influenza or from COVID. Many people have not gotten their updated COVID boosters, and we do know that those help prevent you from getting seriously ill if you end up getting COVID. So it's not too late to get your flu vaccine. It's certainly not too late to get your COVID boosters. And I really encourage everyone to do so.
All right, Dr. Edward Michelson of Texas Tech Physicians of El Paso, thank you so much for spending some time with us today.
Thanks so much, Casey, for having me.
And that's our time for now. Join us this week on KRWG Radio. Every weekday, it's Morning Edition from 5 a.m. to 9, Fresh Air at 11, followed by Here and Now from noon to 2, and All Things Considered from 4 to 7. KRWG News is always online at krwg.org, and we'd like to hear from you. Email us with story ideas and video submissions. The address is feedback@nmsu.edu. For all of us at KRWG News, I'm Casey Counts. Have a great week, and we'll see you next time on Newsmakers.